This patient was referred to me for endodontic treatment of tooth number 30. According to the patient, the crown is about 14 years old. And on Friday, today's Tuesday, on Friday, tooth started to hurt a lot, and then suddenly he developed a swelling. So he had to wait till Monday, yesterday, to go see his dentist. Patient says his dentist put him on antibiotics and gave him some pain medication and referred him to me, for endodontic treatment. And patient says 1 day of antibiotics and the swelling all gone. So when I saw him, there was no swelling. The tooth still hurt. His pain level was about 4 out of 10 today. Upon examination, PFM crown, percussion, palpation, very tender, very sensitive. Probings 2 to 3 millimeters, and as you can see, periapical lucence here and a large one here, as you can see. So we went over options with the patient. Always go over options in detail. You can see how curved these canals are, long and very curved. All right, so went over options with the patient. If you like, we can try to see if we can save the tooth for you. Root canal has about 80% in this case success rate, about 20% failure rate. So I can't promise you a 100% success rate, 100% guarantee that the infection will go away. The alternative is extraction. If you're one of those patients who wants 100% guarantee that the infection will go away, then extractions for you. Patient said, no. I've already lost a few teeth. As you can see, 31 missing and a couple of teeth, a few teeth on the left side. But he said, no, let's try the root canal. And that's what we did today. Went through the PFM crown. And this patient was very anxious. Went through the PFM crown. These were 25 millimeter long roots. 25 millimeters. 4 canal systems. And take a look here. I couldn't believe it. I mean, we got the estimated working length to about 25 millimeters, but I'm like, really? So as you can see, these right now, this is at 22 millimeters. As you can see, I'm about 3 millimeters short here. And this was sitting at 24 millimeters, and you can see I'm about 1 millimeter short here. So they were 25 millimeter long canals. So 2 mesials and 2 distals, and all four were 25 millimeters long. So the working lengths was 25 millimeters. And here's the post-op. Take a look at the curvatures. You can't really tell in this x-ray. So you can see 4 canals, 2 mesials, 2 distals. Look at that beautiful bifurcation in the apical area of the distal root. Look at this angulation here. Now you can appreciate the curvature of these canals. These were all instrumented with stainless steel K-files. I didn't put a night eye there. I just wouldn't dare. Look at all of that anastomosis between the mesial canals there. Look at this angulation. Again, you can see that beautiful anastomosis. You can see that the canals, they join and they separate. Beautiful bifurcation in the distal root apical area, as you can see right there. Look at this angulation. Again, you can see the beautiful anastomosis between the mesial canals. And take a look at this x-ray here. Look at that. You can see the beautiful anatomy of the mesial canals, and you can see the distal canal there. Beautiful apical bifurcation. And look at that right there. Another one right there. Bunch of anatomy here, as you can see. Lots of anatomy. Yeah. So you can see everything went great. We went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. Hopefully he'll come back in 6 months for a post-op, and I'll take a video and post that. Hopefully. if it comes back.